Hello, my name is Scott Kupferman from Clinically Fit, and I have the pleasure of sitting here with Dr. Alejandro Badia, the Chief Medical Officer of Ortho Now Urgent Care Centers in Miami, Florida, and also the founder of the Badia Hand to Shoulder Center. Thank you for joining us, Dr. Badia.
Thanks, Scott.
Why it is that tennis elbow is such a common problem that's so hard to heal and has so many setbacks along the way. What's going on inside that makes that so difficult?
You have to understand what the etiology or cause of tennis elbow is. And it's very similar to, say, shin splints or Achilles tendonitis. The problems, these are basically called enthesopathies. And what the translation for that really is that it is a degeneration of the tendon origin as it comes off the bone. So, Scott, you mentioned about what the elbow strap does, which is kind of the colloquial term for this. The elbow strap, or in this case, the EZElbow System strap, will effectively transfer the origin, or where the tendon comes off the bone. So in your case, rather than feeling all the stress right where the tendon originates and comes down and becomes tendon in your wrist, this is putting pressure and taking the load off. So the reason that this may help is that it may really resolve the original problem, which is stress at the origin of the tendon, which leads to pain. And the reason there is pain is because there is a sort of a degenerative process, meaning the tendon is of a bad quality, and that has to do with blood supply. So to get to the root of the problem, there is something that in some people, and it may not even have a lot to do with activity. In some people, the blood supply of the origin of that tendon is defective. Mm-hmm. And what we're trying to do really here is improve blood flow to that region. And I think that's really why this system gets to the heart of the matter.
You know, one of the things that was important to us when designing this was to really look at tennis elbow from an aerial view. And try to understand it a little bit and see, you know, the common thing that everyone seems to go to is an armband or, if I'm right, a cortisone injection. Yeah. But that doesn't seem to make the problem go away. And when you mentioned the word blood flow, in my head I was thinking about, you know, the reason that we designed our spike plate for acupressure is to increase blood flow. And the reason we have a heat pack is, again, to increase the core temperature of the area to increase blood flow.
Which brings in nutrients to heal that area.
Exactly. Without those...
And even ice, paradoxically, has the effect of bringing blood flow, because when you put it on, it constricts the vessels, but the moment you remove it, it actually increases blood flow. So that's something a lot of people don't realize. So sure. Ice and heat actually have the same long-term effect. So that's what I see as really exceptional about the system, is that it has the same benefits that an elbow strap has of transferring the effective origin of the tendon, or taking the stress off the tendon. But then you've incorporated several modalities, which we term, which are all directed at improving the blood flow.
That's exactly right. And you know, one of the things that was important to us as well is we wanted to come up with a system for tennis elbow. It seemed that it was very fragmented. Yeah. Meaning, you know, wear your armband and, you know, get some heat pack or get some ice and do some exercises, but nothing that was so consistent where it can be an actual system.
But I'm, as a physician and an elbow specialist, I'm trying to really get to the root of the problem, which is try to get tendon healing. Now, sometimes we can't, and that's when there are a variety of surgical procedures. But for the vast majority of people, including myself, I had this when I was a surgical resident at Bellevue Hospital in New York City, and I would be, you know, rotting femurs in the middle of the night, big trauma, and really wincing with the pain. And I wish this system had been around then.
Sure.
But I did try straps, and it helped a bit. But eventually, in most cases, it's something that eventually goes away. But what this does was we'll treat the symptoms and make it more manageable. In many cases, because of the modalities you've incorporated here, in particular the spike plate, this may actually have an effect of increasing that blood flow to affect tendon healing. And that's really a breakthrough, I think.
So the key thing seems to be blood flow.
Yes.
And
absolutely.
blood flow delivers those vitamins, those minerals, those amino acids that are required for the healing process to take place.
Exactly.
And in tendons, different than muscles, tendons don't get as much blood flow as a muscle does.
Correct. I mean, a muscle is red. If you've ever had a nice steak, it is red and it's really full of blood supply. Whereas tendon, if you think about it, when eating a chicken, it's that whitish, rubbery, kind of firm material, and that's
Sure.
the way tendons look in our body. And I see them every day in surgery, and they don't have great blood supply, which is why when someone ruptures their Achilles tendon or tears their rotator cuff, when I'm doing surgery on these areas, it's very hard to get that healing. And this is sort of think of it as a micro tendon tear.
Yes.
And rather than having to actually go in and repair them, the body has the ability to repair it, but this system is giving it a bit of oomph, a help, because again, the blood supply there is not good. So anything you can do to increase blood flow. Now, let me address cortisone shots, because you mentioned that. And I can tell you, I had them. They hurt. They definitely help with the pain, but they do not resolve the problem. And in fact, they can be a little counterproductive, because we all know in medicine that steroids, what we're calling catabolic steroids or corticosteroids, have an effect of actually breaking down tissue, theoretically, which is why you cannot get too many injections. So for your listeners there, if you've had more than 1 or 2 injections, that's enough, because you're actually having a counterproductive effect.
So we have our Xtensor Hand exerciser, which you've been familiar with for some time, and
a lot of our patients.
and what this is designed to do is to strengthen the muscles in the opposite direction of how we use our hands every day. But the way that, and again, correct me if I'm wrong, but the way that it works with the elbow is because the origin of the tendon in the elbow inserts down into the fingers. It's the finger extensors that are
working that area proximally or at the elbow.
So if we can exercise this area, then we're further increasing blood flow, and we're using the muscles as pumps.
Improving the blood flow because you're working the muscle and the tendon, you're stressing the tendon, and you're also, of course, getting some strengthening, which allows the body to absorb that shock and the stress that actually aggravates a condition. Which is why people associate it with tennis, for example. Tennis doesn't really cause this problem. I've been the consultant for one of the major tennis tournaments in the world, right here in Miami, and I can tell you very few of those high-level tennis players actually had tennis elbow. But I'll tell you, the few who have it really hurts.
Yes.
Really hurts.
And you'll do anything to get rid of it.
Yes. So that my tennis and a lot, even more, I'd say my golf athletes really like this, because that not only improves the blood flow and the healing, but it gives them strength in an area, as you were about to allude to, is that we all work on grip. But what happens is there's an imbalance, and the extensors are very weak.
Correct.
And that will always be that way. The flexors are always stronger than the extensors. We all know that when we do tendon repairs in the hand. But this device is really the only thing I know of on the market that actually focuses on strengthening the extensors, which has a direct effect on lateral or epicondylitis or tennis elbow.
Prevent further injury, treat the symptoms, and address the cause. And if you can do those three things with precision, our idea is that you will accelerate the healing process by dramatically increasing blood flow and strengthening the area around it so that it can handle a greater amount of stress. That's correct.
And you really hit the nail on the head, where you are simply accelerating something that the body, for the most part, has the capability of doing on its own. Mm-hmm. If they weren't able to, I as an elbow surgeon would be a lot busier.
Yes.
In other words, the vast majority of people with both lateral and medial epicondylitis do not need surgery. But those people tend to suffer for a year and a half before finally the body's self-limiting capability kicks in. What the EZElbow system does, I think, is really accelerate that.
The whole system, which we call EZElbow Pro, which you'll get the EZElbow armband, all of its accessories, and you'll get an Xtensor hand exerciser with it. So you can do all the things that you need to do to create an environment to reverse the condition that you have, minimize pain, and strengthen the area to try and prevent it from reoccurring in the future.
A healing environment that you're creating and a preventive measure. And I think some of our athletes, and particularly our people who do a lot of typing work and musicians, will particularly appreciate the Extensor just because it works on that concept that I mentioned before of the imbalance between the flexors and the extensors. So these are people who can actually prevent the development of tennis elbow.
Absolutely, and this goes on real easy. It only takes a few seconds, but one of the things that went into the design of this product was we wanted to make it so it was real natural. Most of the people you can look, this is how you would hold your hand when you're eating, when you're driving, when you're doing any activity, holding a tennis racket or a fishing pole. But we wanted to make it so that it had this little tension grid in there that it would allow you to either increase or decrease tension to specific fingers, or to be able to remove. If let's say you're treating a person that has a severe case of tennis elbow, would it be correct to say that the middle finger is the direct channel right up into that tendon?
Yeah, it's usually the one where you do the test where you have the person resist, and that's where they'll really wince in pain. It's usually the middle finger is the most.
Yeah. So a severe case of tennis elbow shouldn't necessarily avoid using this from the beginning, but perhaps
take that one out of the equation
and let it just go along for the ride.
Otherwise, your patient may not come back.
They'll feel a little upset. So you can see how this works, and I don't know if the camera can get a view of this, but as you wiggle your fingers, and you notice that extensor tendon with that middle finger. So for those of you out there with severe tennis elbow that are really looking for a system to work with, if you do wind up using the Extensor as part of the EZElbow Pro system, remove this the middle finger from being tethered to a finger band until you feel some relief coming about, where you can add more resistance.
So I might add also that the Extensor, I use it a lot in my patients with medial epicondylitis because it has two effects. One is it corrects a little bit that imbalance I've been talking about.
We have the 5 core exercises for the Xtensor hand exerciser, where it's in the, as you call it, the pronated position. Yep. We have the neutral position, right, and we have the supine position. Right. But then we add 2 more exercises as the core 5, so to speak, where you are starting from a prone position and rotating as you extend your fingers open, and then from the supine position, extending your fingers while you rotate down into the prone position. Would those 5 core exercises be a part of every routine if you're doing upper extremity work?
Yeah, because then that way you're working the muscle from different angles, but it's important to also incorporate elbow flexion or bending the elbow and straightening, because you're taking tension off of both the medial and lateral epicondyle, both areas, and when you extend or straighten the arm, then you're putting a little more stress on them. Sure. So that's really to be complete, and because you don't have to do that many sets, so this is something that you can literally do in about an 8 or 10 minute period and really do a complete program.
One of the things that we noticed when we were building the Xtensor hand exerciser is, because our hands are designed to help us grasp, that's biological. Without that ability, we would not be able to do anything. But what happens is the flexor muscles seem to get so much more powerful. They get thicker, they get stronger, but as a consequence, our hands curl inward over the course of time. It's almost like if you look at a newborn baby, their hands are like this because they haven't started that process of grasping everything.
And as we get older, people get contractures. So a common indication for us to have to do surgically, unfortunately, is people oftentimes in nursing homes with dementia, they lose the ability to extend. So this is just something that's probably good for us in general. As part of any exercise program is to work a little bit on our forearms.
A lot of times when I'm going to the gym and I'm doing my exercises, or when I was using the squeeze balls, for flexion of my grip, you go and you go through your repetitions, whatever your exercise is. One of the things that we encourage our users to do is to maintain an extended isometric hold. So what we're trying to do is deepen the strengthening process in the extensor region while simultaneously getting a repetitive flexibility exercise to the muscles in the palms to help dynamically rebalance the area.
Agonistic and antagonistic effect.
Is fisherman's elbow like the same as tennis elbow?
Yes. Again, it's just a term that reflects what people think might cause it. I think what's important is for our listeners to realize that these are simply activities that aggravate, but they don't really cause the condition. And there are some people who are just prone to it, myself included.
Yeah.
When I was a resident, I was doing the same thing as the other 20 surgeons were doing, up all night and, maybe having a little time to go to the gym. I couldn't blame it on doing surgery or going to the gym. It's just that some people, myself included, maybe the blood supply to that area of the tendon is just not adequate. So I don't think fishing causes this per se, but if you're prone to this, fishing will certainly aggravate it.
And that repetitive activity is really not dissimilar to a backhand or a forehand if you're fishing or anything.
Or typing for long periods of time, and you blame it on the keyboard, but there's a lot of people nowadays, who doesn't use a keyboard now? And fortunately not everyone gets tennis or golfer's elbow. But at least when you feel that coming on, or you really want to prevent it, we have a system now that I feel, at least in my practice, has helped our patients tremendously.
So you have EZElbow and EZElbow Pro. EZElbow is designed to prevent further injury with the counterforce brace, tennis elbow strap, whatever you might want to call it. There are literally dozens of these out there. But what we wanted to do is set this one apart. Make it a product that's used during your activities that can help you prevent the injury from getting worse by being able to have a compression platform that has elastic material on it, but also by having a compression platform that enables you to interchange different treatment modalities, whether it's targeted acupressure, an ice pack, which, by the way, this goes into your freezer for a minimum of 1 hour and it's ready to use. It'll last for 20 or 30 minutes. And the heat pack can be put into a cup of boiling water for 3 minutes. And if you, it'll get a little hotter in the cup of boiling water than it will when you use it as an instant heat pack. But when you use it instantly for heat on the go, you'll get it up to about 130 degrees. Now, am I right in saying that when you're looking to heat an area, you're really only looking to get it to increase by a few degrees to get that blood flow?
Well, yeah, you just want to augment the blood flow, and it doesn't really need to be hot.
It doesn't need to be hot.
Yeah, it has to have the effect of vasodilation or opening up the blood vessels, which, of course, as you mentioned, brings in these growth factors that help. And, of course, that's the whole reason for now these other modalities, such as PRP, which, theoretically is a good idea. Yeah. But, those injections hurt. Yes. The literature is not really fully out on this, and I think using a system like this is a lot easier and less costly. Yes, in today's environment in healthcare, we have to be conscious of that.
So the lessons that I take from you, Dr. Badia, and I thank you for your time. The most important thing I take from this is increased blood flow.
Yes,
that's that's where I take this. The second thing I say is, prevent the injury from getting worse. Use a counterforce brace.
Transfer the load.
The spike plate, and this is a pretty cool product that we designed, because not only will it fit into your armband, but by putting this little strap on it, and the idea of selling them in pairs is to be able to put them on your hands, and then you can apply that targeted acupressure to help relieve pain and increase blood flow to the area. EZElbow will come with the EZElbow Armband. And the EZElbow Armband has this compression platform that will target the compression for you. And at the same time, this material was very important for us to find, because we wanted it to be able to have temperature transfer. The few armbands that may be out there that do have a heat pack to them, you're trying to get the temperature to transfer through a very thick material, and generally it winds up being very ineffective. You will feel whatever that temperature is, whether hot or cold, and with the compression it just furthers that. Dr. Badia, again, thank you for your time and just for making this possible for me and for everybody else to understand. And
thank you. We're excited about this, and it's an important part of our treatment armamentarium.
Thank you.